Video, we're going to be talking about the principles of general cupping. You'll see two of these cups here, one for static cupping, one for dynamic or mobility cupping. You see how forgiving it is. The general principle in cupping is a lot like this folded towel. Your muscles have sheets or layers to them, just like there's layers folded in this towel. So as an example, with overuse injuries, or just overuse in general, Ms. Cheryl has a lot of tight musculature here in her deltoid muscles. So what's happening is those sheets of muscles are each getting inflamed, full of lactic acid, etc. And when that happens and they become engorged and full, they stop blood flow from happening, so you're decreasing oxygen flow. So cupping is a good way to come over this area and pull the tissue out so you can open it up and you can create blood flow in the area. You might have seen like Michael Phelps or some of the other folks that have been cupped, and you'll see little bruise spots. It's a misnomer that everybody will always bruise. Okay, in this method here, I'll show you that. If we just do this simply with her, the static cupping, we take this and leave this here. And we might do a second one. We might leave this here, all the way down her arm. The areas where she had the most dense congested tissue, say that's here and not here, this one might show some bruising because it's pulling out that old stagnant blood, whereas this one was having the same problem, so you don't see the same level of bruising there. So ideally over time, as we do cupping, you'd see less and less bruising on people. Of course, we try to relegate it so that people are not having a whole lot of bruising that's really uncomfortable. The other form, the dynamic cupping, is just that. We put a cup like this on here, and then what we can do is we can move it. We can get larger surface areas covered. We do both kinds. There's even a form of dynamic cupping, say on the bicep, where you move her through the range of motion while we're cupping. So it depends upon what's going on. But this one has this mobility. I'll teach patients to do a little bit of this safely on themselves, and this is the kind I'll generally teach because it's the safest kind. So in general, what we're trying to do is restore blood flow and oxygenation of the tissues to the various affected areas, which are again very common in athletes, okay, the cyclists that we might know. To help with restoring blood flow, tissue oxygenation. So that's it in terms of the general basis of generalized cupping and how we apply it. Thank you for watching.